Good morning. This is Dave Boddy on behalf of Bodyguards United presents the Autopsy with Dave Boddy tonight. Or sorry, this morning. My special guest is David Reiss, a North American renowned psychiatrist who I befriended through my friend Bob on Facebook, and him and I have grown to build a relationship due to my concussion experiences and my past with depression. And we've been discussing some shared panels and appearances together, so I would like to ask David Reiss to please share how he got involved in the practice and his work in psychology.
Yeah, good morning. Thanks for having me. Yeah, I'm a psychiatrist, been a psychiatrist for too many years, about 30 years.
Oh, wow.
Currently based in San Diego, although I practice on both coasts and I'm all over the place. Most of my practice has actually been in the California workers' comp system, so I've seen a lot of people with injuries, non-sports injuries, but often includes head injuries with secondary emotional problems, depression. But I've also always been interested in sports. I did my first sports medicine work back with the Northwestern football team during medical school, and that was many years ago. Those were the days where a concussion was defined as loss of consciousness for more than 5 minutes, and if the player knew basically which direction to run in, and maybe who the team we were playing was, he went right back on the field. So I've always been interested in sports. I've never been very good at it, but I've been on the sidelines, including involvement in horse racing as an official and as an owner. So I know a lot about that and a lot about the trainers, the jockeys, the drivers, and more recently professional wrestling, where I've also had contacts on different levels.
Oh, wow. So you got pretty involved, eh?
Yeah, you know, one of the things, without going way off course, is within the California workers' comp system, there's a quirk in the law where any professional athlete who has an injury, that any part of it happened in a game they played in California, even if they played for a non-California team, can file a claim through the California system. So I've evaluated athletes from many sports, professional sports, people whose name you'd recognize, all-stars who've come through the California workers' comp system. So that also got me very involved in just all the stresses related to sports, as well as specifically head injury, football, hockey, soccer, any number of different sports.
Oh, wow. So how often do you usually get like evaluations set in, and like how busy are you currently?
Well, the whole workers' comp system here is a mess. I won't bore you with that. Athletes, you know, they don't file the stress claim, the psychiatric claim a lot because there's still a stigma. So it's a limited number. But in terms of the number of evaluations of people I've seen with injuries, of which probably 20% included head injuries, I've evaluated or treated over 10,000 people over the years.
Oh, wow. That's impressive. 10,000.
That's a lot of stories. A lot of stories, I could tell. But of course, that's all confidential. But a lot of, you name it, I've seen it, I've heard it.
So, like, what's your opinion on situations that are currently happening in the NHL and NFL in regards to head injuries and how sometimes they're hidden and misdiagnosed on purpose?
Right. I mean, we have a combination of, one, a lot of the data is new. We really don't know a lot about it, and you can't fault anyone 5-10 years ago for not knowing what wasn't known. We have a very political situation where there's a lot of money involved on both sides, on the team side and also on the players' side. I mean, I've spoken to players' agents who you would think have their players' best interests at heart, but you know, they'd rather get the 10% this year and have the guy on the shelf for 6 months or a year and then hope he comes back. So there are a lot of negative pressures involved. There's a lot of just unknown, and then there are a lot of people who still aren't really up to date on what we do know, or at least the best information we have currently.
Oh, wow. So, like, there's been a lot of information about, and I've read most of it off of your Facebook page because you share a lot of it, where people are being diagnosed with like symptoms and etc. just to hide concussions and other situations that may prevent them from having ice time or field time. And I understand you feel the same way with me, which is that is wrong. So, like, how do you think we can help and bring awareness to this has to stop?
Well, I think, part of the problem is, try to talk to a 19, 20, 22-year-old, especially one who has a chance of making a lot of money or even playing in school, and get him to think about his future 30 years from now. If you find a way to do that, let me know.
Touche, touche.
And actually, the best way to do it is by having other athletes talk to them, because hearing it from a doc doesn't always carry much weight, or it will be very impressive for 5 minutes, and then the next day they'll be back to it. There's a lot of peer pressure, etc. So you're dealing with a population that, just because they're young and because they're motivated to go in a certain direction, really don't know the difference between pain and injury. And playing through pain as opposed to playing through an injury, and where to draw the line. And then if you get coaches, agents, docs who aren't informed or who really don't have their priorities straight, it gets problematic, not only for the people in the pros and the people who are headed for the pros, but even more so to some extent for the people who don't have what it takes. I was talking to the neurologist of one of the NFL teams, who said that he's most concerned about the high school and college players who have no chance to make it to the pros. Because when you get a 300-pound guy with a lot of skill hitting a 220-pound guy with very little skill, guess who's getting the damage? It's the guy who's never going to get drafted and is going to leave school with some damage, with something brewing, never know about it until it's too late, and not get any treatment for it. So we have a big problem in the major sports, but there's even more of a problem outside of sports for people who played school ball. And I see that a lot in my clinical practice, where when I take a detailed history, oh yeah, I played football in high school, oh yeah, I got dinged a couple of times, and you trace it back and you could see that there are some effects of that.
So do you feel that most of it is really not the agent's fault or the team's fault or the coach's fault? It's more or less the individual sometimes not taking accountable and admitting to it, and it hurt?
It's a combination of each. Again, you can't really count on a young person to take full responsibility. They need guidance, so surely the coaches, the mentors, the owners, the schools, all should have some responsibility. But everyone needs to be on the same page, and right now they're not on the same page, they're not even in the same book.
Correct. There's a lot of finances. Do you think that maybe in regards to professional sports that the fans also have a input on this, and with how they react with like for example, Sidney Crosby had a concussion and people were going crazy about how they lost Crosby, and now they feel that their line won't be as dominant without Crosby. So do you feel that the teams take that into account as well?
Definitely, there's definitely pressure from the fans, which can be very cruel. I happened to be in Pittsburgh last week for this and watched the 7th game in Pittsburgh. And the next day, that you'd think that Crosby probably deposed Putin. He was #1 in the news, and it was all Crosby all day, and that's a lot of pressure. And I know nothing about him personally, but for any star athlete or any, there's a lot of pressure to perform for the team, to perform for the fans, and they're looking at this season, this year, this game. They're not looking at where you're going to be 3 years from now, or you're going to extend your career, or where you're going to be when you're 55 years old.
Correct. I can agree with that. Now, you did mention earlier when we were talking about this headhunting problem that's going on. Could you elaborate as exactly what that is?
Well, this goes back a couple years now, where it came out, and I don't remember all the details, and this is all public knowledge, there's nothing inside on my part, but it came out that I guess it was 1 or 2 of the coaches on the New Orleans Saints were actually offering bounties, cash bounties, to players to injure opposing players. And we're not talking about just making hard hits or playing tough. I'm talking about getting money for causing injury, and that's really not part of the game. It's part of boxing, it's part of MMA, it's not part of football. Now, they got in trouble for it, people got suspended, although I think they all have their jobs back pretty much. Surprisingly, I don't think anyone got indicted or any criminal charges, because actually it's what's the difference between that and, I mean, not murder, but assault for hire? But there's so much politics, it didn't go that direction. But it goes from the clean hits, which are damaging, which are just part of the game, to some really nasty stuff that's out there and everybody knows about it, but no one really wants to look about it.
Holy cow! So amongst your practice, do you deal quite often a lot with high school students with head injuries and depression related to concussions?
I actually don't deal directly with high school. I mean, I used to do a lot of adolescent work. I don't now, but I see a lot of adults or young adults who had injuries during those years. And when you track back, you can never prove it, but you can suspect that that's part of what's going on. That's part of what may lead to a pattern of impulsiveness or pattern of emotional vulnerability. When there's a severe head injury, you can test for it. But the minor head injury, what they call CTE, the chronic traumatic encephalopathy, the only way you can know it's there is on autopsy. You don't want to go there, obviously. So we're really dealing with symptoms that we have to make educated guesses of what's causing them and how to treat them, which is problematic because if someone has a depression that really is related to head injury, they're going to respond differently to therapy and even differently to medications than someone who has a depression that doesn't involve head injury. So it can get very complicated and problematic.
Okay, you also did mention earlier before we went broadcast that you mentioned that there's two types of depression. There's the first or secondary, I think you said?
Right. I mean, you can look at it as that there can be a primary depression, which is due to the neurological changes in the brain due to head injury. That just, some things aren't working right. There's been some damage. It may be very subtle. It may not show up on an MRI or an EEG, but if you use a computer analogy, there's some hardware that just isn't working right, and that affects control of emotions or impulses. So you can have depression that really has a purely neurological basis. Then you get, in a sense, the secondary depression, which is when a person realizes that they're not functioning as well as they should, realizes maybe they're having problems with memory, or having chronic headaches or other problems, and that in itself is depressing on a psychological basis. So in a sense you have both the hardware and the software that you have to look at.
Oh, well, the reason why I brought that up is because that's pretty personal to me, considering I've suffered 15 severe concussions, and all my symptoms were very consistent. I had depression, I had memory issues, I had emotional instability, I had the inability to focus. But that is also in part with me being diagnosed with ADD in grade 7. And when I suffered my 12th concussion, I got hit in the head with a shovel 3 times during an assault, and that's when my psychologist and the doctor I was seeing in rehab said that was a concussion that started the downfall, because it affected a lot of my memory. It affected my the part of my brain that helps control your emotions.
Right.
It happened in 2006. I then suffered another concussion in 2007, and another one in 2008, and another one in 2009, and my last one was in 2011. When I got diagnosed in 2011, it was about a week after my diagnosis, I got sent to the brain injury rehab because the WCB, which is the Workers' Compensation Board, realized that I was not getting the help that was needed. The doctors were constantly telling me, "You're going to be fine in a week, relax, just rest." And I was informed of my depression and the mental state that I was experiencing that was different to how I usually was.
Oh.
I was suicidal in 2006. I lost my wrestling career, lost my security career for a little while, so depression. The depression there was pretty severe. I didn't know how to respond to it. I notified my doctors, but like usual, they put it in the rug. They said that it's just a temporary feeling due to a current situation. 2011 came, suffered my other concussion, and the depression got extremely worse, and I was suicidal again. Finally, I was noticed of this, and people took it seriously, and I was finally sent for help. When I got to rehab, that's when I was seeing over 9 or 10 therapists. I was personal therapists, I was seeing psychological therapists, behavioral therapists. I was seeing a whole wide range of people that were letting me know that the depression started in 2006, and being that I was wrongfully diagnosed and unsupported for 5 years, the concussion got worse, the depression just got worse. Now, the reason why I brought that up is because I never really got the help I needed. So I'm just wondering, like, how can we get doctors properly diagnosed and take situations seriously? Because at this time, concussions were not really a big deal at that time.
Right. I mean, the old thought used to be, and when I say old, we're talking about 5, 10 years, surely 10 years ago, but even 5 years ago, was that neurological damage basically got better within a year. What didn't get better didn't get better, but basically would take a year and you'd get better. It wasn't at all recognized that it was as complicated as it is, and there was very little known about treatment. A lot of doctors really aren't necessarily up on the most recent research, and even the most recent research isn't very clear. We still have a lot of unknowns, but it's important to find, whether it's a psychiatrist, psychologist, neurologist, or general practitioner who understands how complicated it is that you're dealing with, as I say, both hardware and software, and at times the treatment for the hardware can make the software worse, and at times the treatment for the software can make the hardware problems worse. So you really it's a difficult tightrope to walk, but you really need a comprehensive treatment, and the important thing is that all the people treating need to integrate what they're doing. Because I see so many people where one doc is prescribing a medication to prescribe one symptom that is actually making 3 other symptoms worse. So you have another doc prescribing medications for those symptoms, which is making the original symptom worse. You end up with someone seeing multiple doctors on multiple medications and getting medications to treat the side effects of medications, and you end up with a complete mess.
Oh, wow. So, like, I was never prescribed medication, thankfully. I refused. I told them, I was like, unless you can 100% guarantee that the side effects won't worsen or I won't have any increased side effects, I don't want to take medication. So I just relied on a lot of rest and Advil, basically. However, I started to realize that during the months and the years progressed, that I was experiencing a lot of emotional situations, such as I would lose my temper. And I define it as I would emotionally black out. I wouldn't remember anything that happened.
Right.
What I did, what I said. I would be informed of it, and then I would get more depressed because I got told this is what you did, and I was like, I don't remember that at all, so it made me more unaware.
Exactly, that's the secondary depression that I'm talking. That where you become aware of what's happening, which makes you more depressed beyond the neurological effects themselves.
Correct. I was becoming very estranged with myself. I didn't know who I was or who I was becoming, and there was days where I'd wake up and I'd have flashbacks of what I did or what I said, but I wouldn't know exactly when I did it or to who. So it drove me, like, I don't want to say mentally insane, but it drove me to a degree where I was at war with myself every day with memories and trying to figure out who I was. And then and the reason why I got more concerned was during this time of my depression and trying to figure out who I was, the whole Chris Benoit situation happened with his concussions and his unfortunate how he became deceased with his family, and when that happened, it got me a lot more alarmed, a lot more concerned.
Sure. Yeah, because one of the big problems is that as someone gets into it and their behavior goes off, you can alienate friends and family, so people who should be supportive tend to stay away, and that just makes things worse. On the other hand, you can't blame them it's no one's fault, but you really need someone to try to pull everything together, and that's not often easily done.
Correct. Like, I had support. However, the support I had, I felt wasn't efficient because you always have that personal attachment to people who go through what you're going through, and they understand it. So it was very difficult for me to find the support because no one understood what I was going through because it wasn't physical. You couldn't see me dealing with this. It was all in my head. It was all mental. So people were thinking that it's all I made up myself. I'm just using it as an excuse. But really, I knew I was not myself. I just couldn't.
Right. Yeah, there are a lot more support systems available now on the net, on Facebook, where people really can, deal with it with people who understand. Because otherwise, as you say, it's not an injury people can see. Most people don't have a good conception of it. And also the nature of the injury is that the symptoms fluctuate. So it can be very confusing to other people. And people may either withdraw or get angry or just say, pull it together, and that's not helpful at all.
Oh, most definitely. Like my symptoms were pretty consistent. Some concussions were more severe. However, my PCS, my post-concussion syndrome, would last minimum a month to two for me. I'd have dizzy spells. I now have permanent dizzy spells where daily I can have a dizzy spell that lasts either from a minute to an hour, and it's uncontrollable. I don't know how to control it. My last one lasted for an hour and 10 minutes when I was working at Future Shop doing warehouse.
Yeah.
Boss at the time wasn't really comfortable with how to deal with it, and so I had to tell my history, my depression, and all the concussion damage I had. But
Yeah.
after a while, when you had to do that sharing of your story over and over again, because no one really understands mental illness, they don't understand what exactly is happening, and with ADD, schizophrenia, and so many other types that they're just like, okay, there's too many out there to understand just one version.
Right, and a lot of even doctors and therapists don't understand that the typical treatments don't always work. You know, whether you're talking about counseling where you may have a great session, but because of the memory problems or flashbacks, you know, what makes sense one day and what is a really helpful session may not be there for you 2 days later. And the therapist has to be aware that things have to be repeated, that you have to go over things, you have to keep track of what's going on. And the same thing with medications. You know, the medications that will typically help depression sometimes make these symptoms worse. Now, there are some medications that can be useful at times, but they have to be dealt with very carefully and really monitored carefully, and being aware of all the potential side effects. But as I say, even in therapy, you know, if you're dealing with someone whose memory isn't there, you can't assume that advances that are made within 1 or 2 sessions are necessarily going to stick. You have to go over things. You have to involve family. You have to involve friends. It really involves a support system and understanding how it affects the entire person, not just the symptom.
I can agree with that. When I was in rehab, I actually had paperwork. I was living with my best friends at the time in their house, and I would bring the paperwork home, and they were to fill it out, saying, "What have you noticed with Dave's behavior today? What have you noticed that has changed since yesterday, sorry," and so forth. And my friend Jesse was always concerned because every day I would show further symptoms. Like one day I said, "Let's have that piece of cake," and he's like, "Buddy, we already had that cake." And I was like, "No, I don't remember having a piece of cake, even though it was like an hour before."
Yeah.
Fast forward to today. My current girlfriend is noticing that I'm still having some issues. I will tell her something 3 times, and the 4th time I'll be very adamant to say, "No, I haven't told you this." The dizzy, they're very active. They're very still current. And I was told that I couldn't operate a motor vehicle until I saw a neurologist again to get further testing, because they had to wait about 2 to 4 years after my initial concussion in 2011 to further investigate if there's any changes. And with the dizzy spells and memory issues and other issues I have is where I'll have flashbacks. Like her and I went to a mall where I got assaulted, and I had no memory of the incident in 2011 when it happened, but we went there about 3 months ago.
Yeah.
And walking the area where it happened, I didn't get depressed, but I got overwhelmed with a lot of emotion and memory, and I was like, "Holy, where is this coming from?"
And sometimes that will even come up more physically in terms of physical symptoms that are related to the trauma or anxiety. It may come up emotionally, it may come up physically. But, you know, it takes a lot of patience from the people who are around you and who are supportive. And it also takes doing what you're doing, which is being aware of your limitations and looking them in the eyes so that when you don't remember something, you know, after you insist once or twice that you weren't told, you realize, you know, I probably was told.
Yes.
And because if someone doesn't get to that level of recognition, it's just going to alienate people more. So it takes patience mostly on the part of the person who's injured, but also on the part of the people around them.
Oh, most definitely, because like sometimes my family would get upset because I don't have my driver's license yet, or I keep getting minor details, and I get frustrated because I'm like, I don't know how many times I got to tell you this, but I'm not cleared to drive a vehicle until at least 2015 until I can actually get more examinations done, which, unless it's referred, it's going to be a long process, because here in Canada it takes a while to get that process rolling. So it's very frustrating being a person who's surviving with concussion symptoms and permanent damage, and that's why it was important for me to get this interview with you to help people who are going through it as well.
And I'll just add, as I say, there are a lot of groups, support groups growing up, and there are a lot of professional groups out there now. but find one that's legitimate. And when people give you advice, check it out. Because there's a lot of bad advice out there also, both from people in general, even people who are going through it, because they may have gotten the advice from who knows where, but also from professionals. So be careful. Don't believe everything you're told, but certainly the support groups can be very helpful. Professionals who know what they're doing can be helpful, but just like with everything else in society, once an issue hits big, you get the dark side of it. You get the people getting into it to make money or to make a name for themselves. And matter of fact, I was at the Sports Lawyers Association meeting a couple weeks ago, what someone referred to as the head injury sports medical complex, where you have people jumping on the bandwagon, setting up programs, taking money, and maybe they're helping a little bit, but sometimes it's a lot of snake oil. So you really have to be careful. Get into some good support groups, find the support. Don't be paranoid about it, but be judicious.
That makes a lot of sense. When I started sharing my story about concussions and what I was going through, it was amazing how many people said, "Oh wow, I had concussion here, I had a concussion there, but I never got diagnosed. I never really took care of it." Then I had an individual say he had over 16 concussions, and I was like, "Okay, well, do you have any lingering issues or situations that you know?" He's like, "No, I feel perfectly fine." I'm like, "Well, that's kind of strange to have 16 diagnosed concussions that have no permanent results or no permanent issues. Like, is that possible?"
Yeah, it's possible because everybody's different and we don't know enough about it, but denial comes into play also. Let me tell you one little story. I won't mention any names. I won't even tell you what state it was in. But maybe this would be a good place to sum up. But I was at a conference on sports, head injury, stress, etc., and there were two professional athletes there, one of who was very openly talking about how he or she, I won't even be specific that way, was aware of their limitations, and the other one who was saying that he or she wasn't affected at all. And the person who said they were aware gave an excellent talk. The person who said they had no problems whatsoever, it was even difficult to follow at times. They had so much problem putting words together and putting thoughts together. So there was, in my, at least for that day, it looked to me like there was a lot of denial going on there. So it's difficult.
It can be pretty hard to accept that you have brain damage because it sounds so intense. Like when I first got the phone call and I was told to go talk to my therapist right away, so I went and I was actually on my way home. She said, "Come back. We have an important discussion to discuss with you." So I went back, and then they said that they're like, "We feel like you're gonna have permanent brain damage in regards to vision and cognibility." What that meant was, if I'm given a map or a graph or anything that has a high amount of colors, shapes, letters, and so forth, I immediately get dizzy. I immediately get a headache, and I lose focus, and I get very stressed.
Yeah.
And so it's very hard to accept when you hear you have brain damage. Like it sounds very traumatic.
It is, and there's no doubt that being realistic, there are some problems that become chronic. But the good side of it is that the more we learn that the brain is actually more repairable and more plastic, if I could use that term, than we thought. That nerves can regenerate, that functioning can be restored. So if anyone tells you absolutely, definitely, this isn't coming back, unless there's a lesion that someone can actually see and knows there's matter missing from the brain, we're learning that's not necessarily so. Things can improve. It's a long course. Not everything's going to improve. But, in some ways, a lot of ways it's worse than we thought, but in some ways it's not as bad as we feared. So it helps to keep that in perspective also. And we are on the cusp of finding new treatments. And some of them are very simple, in terms of sleep, relaxation, exercise, weight control. There's good evidence that just carrying extra weight actually is a significant problem that affects brain functioning when someone has an injury. So there are more and more things we're finding that can help, even if it can't cure.
I can agree with that. I battled weight issues for numerous years during my concussions. I found that working out was very difficult, and keeping my stamina was next near to impossible. However, over the last 2 years, I've developed a at-home regimen to work out, which I shared with you a while ago, actually. So I developed that. I developed the training that I got from my therapy, and I was able to lose 100 pounds, and I started to feel very good. I started to feel very more, endurant. I felt my stamina was great. However, I still had issues with the memory, but I accepted that, and I tell people that I've accepted what is potentially going to be there forever. Although I do find myself sometimes going through in and out of slumps. Like I'm not going to lie to you, the last week I've had days where I've just been not myself and not really depressed, but down and questioning my life past and where I'm going. And so it's a constant battle.
Right, and it's important to keep that in perspective and basically to plan for that, to know that you are going to have down times, not to panic when it occurs, to really make plans how you're going to make sure you don't get desperate, but to realize that there are going to be some crappy moments, and I'm going to feel like shit now and then. Excuse my language, but that's the reality of it. And to be able to plan for that, and with your friends and family to say, there are times I'm going to be an ass, and just call me on it. If I get defensive, tell me to just check myself out, and to make sure I get back on track, and to have patience with yourself. Even in terms of exercise, it may have to start with just some very gentle yoga or meditation, and then move up to physical exercise. But be kind to yourself. Try to have others be kind for you, and patience, 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 which is the hardest thing to do when you have those kinds of problems. It's like the old statement, God grant me patience and give it to me now. But it is something to be aware of. The more insight you have that it's something you have to live with, but it's something you can learn to cope with, the less you'll get into the vicious cycle of depression causing more despair, and just say, okay, this is a lousy day. Let me put some stuff off till tomorrow. I'll probably be feeling better in a day or two. Put on my boots, wade through the crap, get through this, and then we'll go on. And the more, that's not easier said than done, believe me. But the more you can do that, the less you get into the vicious cycle and the dark holes.
I can agree with that totally. There's with my work, I have issues when I'm working some days. Like my last job was a warehouse job. However, there was a lot of technicality to it, a lot of you must remember to do this. And I found that there was days where I would just lose so much focus, and then I'd be reprimanded and disciplined, and I would try to state my case to my boss, saying, "I'm sorry, but this is what I've been dealing with since I was 4 years old when I had my first concussion." He's like, I don't understand any of that. He's like, just focus at work. I'm like, okay, well, this is a means where I can educate you, and I can tell you what's happening, what is actually, air quote, the real world, where mental illness is becoming such a huge plague. And then there's incidents where people conduct murders and robberies, and they claim mental illness, and then they find out that they actually are mentally ill, and then the public gets all outraged in regards to how they got off the charge.
Right, and I probably need to end at this and get back to my work. But let me just say this, because that just came up this last week with the tragedies that occurred here in California. A lot of people who commit terrible acts are almost by definition mentally ill. But the vast majority of people who are mentally ill do not commit violent acts. In fact, they're much more likely to be the victim of violence than the perpetrator. So, if you follow the media, you get a very misguided view, as if someone who's mentally ill is inclined to be violent. No, someone who's mentally ill is likely to be a victim of violence. Surely those that few, and it thankfully is very few, who commit these horrendous acts are mentally ill for the most part, without going to any individual, but those are the, one of very few percent of people who have serious problems and never become violent or dangerous.
Oh, wow. Well, thank you for sharing that, because it's been a world issue, because it's been used everywhere, and people are claiming mental illness, and sometimes they feel that it's just it's a false claim to get off the charge. But like I said, unless you have mental illness yourself, or you've been through it, or you know someone that has, it's very hard to understand.
Well, once you get the legal system involved, it gets even crazier. in terms of when is it real, what's real, where the responsibilities lie, and that's really a whole different issue. You're absolutely right. But it shouldn't be used to avoid dealing with the very real problems that can cause great damage, but usually not violence. It causes damages in terms of relationships, families, functioning, but it's the very rare case where it involves violence.
Wow. Well, thank you. I understand you have a lot of work to do today. As you're nonstop, you're constantly, as the word here is, you're hustling.
Right. Yeah. Just for anyone interested, I'll be giving 2 seminars at the Cauliflower Alley Club reunion in Vegas coming up next week, and then heading to the East Coast from there, where I'll be heading to Boston, then working in Vermont for a while, and shooting down to New York City. If anyone wants to get in contact with me, please do.
Do you have a website that you can quickly advertise?
Sure. It's www, and my initials, DMR Dynamics, as one word, DMR Dynamics. That's my website. That's my Twitter. Feel free to contact me.
That's .com?
.com.
Awesome. Well, I will surely include all that information for our viewers. And thanks again for your time, Dr. Reiss, and we'll definitely stay in touch.
Thank you. Best to you and the great work you're doing.
Awesome. Thank you.
Have a good day.
You as well.